evidence-based and collaborative responses to substance use disorders into your focus. We are honored to be joined today by the eminent speakers who are experts in fields of drug policy, community health, and public sector governance. Their experiences will help us to work together to reduce harm, empower communities, and place public health at the center of drug-related interventions. I now invite the chairpersons of this plenary, Dr. Indika Vanninayaka, Chairman of the National Dangerous Drug Control Board, and Professor Upul Senarat, Chair Professor of Community Medicine, University of Colombo, and Scientific Co-Chair of the Summit, to take the session forward. May I now warmly invite Professor Upul Senarat and Dr. Vanninayaka to kindly take their seats at the head table. Over to you, sir.
A very good afternoon, distinguished guests, respected panelists, and participants. It is my great pleasure to welcome you all to this dedicated session on substance use and public health with the theme Bridging the Gaps Through Policy, Practices, and Partnerships. This session is organized by National Dangerous Drugs Control Board under the broader umbrella of the Global Public Health Summit 2025. This session brings together key voices from policy, academia, and practices to explore the growing intersection of substance use and public health in Sri Lanka and beyond. The NDDCB is the apex national institution mandated with the coordination, planning, and implementation of drug demand and supply reduction strategies in Sri Lanka. The responsibilities of NDDCB span across policy formation, treatment and rehabilitation, outreach, drug education, research, and law enforcement coordination. With the multidisciplinary approach and strong focus on evidence-based action, NDDCB works closely with national stakeholders and international partners to address the manifest challenges of drug use. Our presence at this forum reflects the board's firm commitment to strengthen public health responses to substance use. The theme of this session, Brings Gaps Through Policy, Practices, and Partnerships, echoes the NDDCB's on strategic priorities as well. What we believe is this: integrating drug policy into broader health and development agendas and promoting collaboration between institutions is essential to create resilient and responsive systems. Ladies and gentlemen, today's session is structured to reflect that very collaboration among parties. We will begin with an introductory presentation by the chairman of NDDCB, and also we have an expert panel who will reach into critical dimensions of issue ranging from co-occurring psychiatric conditions, the role of tobacco and nicotine industry, to challenges in youth alcohol and tobacco use. We will also hear from the experts in the field about two insightful studies from our own local context. The session is therefore not just a dialogue, but a collective call for action. It is our hope that today's discussion will help strengthen evidence-based policy making, promote cross-sector collaboration, and inspire scalable solutions to reduce the public health burden of substance use. So, ladies and gentlemen, I would like to invite the chair of the panel, Professor Upul Senarat, to start the session.
Thank you. On behalf of the organizers of the Global Public Health Summit, I have the privilege and honor to introduce our first speaker, Dr. Indika Vaninayaka. He is a distinguished medical administrator and public health leader in Sri Lanka, currently serving as the chairman of the National Dangerous Drug Control Board. Under his leadership, NDDCB plays a pivotal role in advancing national strategies on drug prevention, treatment, rehabilitation, and policy reform, emphasizing evidence-based practices, intersectoral collaborations, and international cooperation. He also represents NDDCB as a member of the board of directors of the National Authority on Tobacco and Alcohol, NATA, and the National Bureau for Rehabilitation, contributing to broader health and social development agendas. Dr. Vaninayaka holds an MD and MSc in Medical Administration from the University of Colombo, and postgraduate diploma in Public Management from SLEJA, and he is MBBS from the University of Sri Jayawardenepura. So his speech is about, he's going to make an introductory remark and key presentation on the current and emerging drug use trends in Sri Lanka. So over to you, Dr. Vanina.
Good afternoon, all of you, and warmly welcome to our plenary session conducted by the National Dangerous Drug Control Board. And dear Chair, I start my presentation regarding the substance use and public health, bridging gap through the policy, practice, and partnerships. Actually, this session brings together all stakeholders, all the disciplines, get together to expose the evidence, policy, and the community practices to address the substance use disorder, one of the critical public health challenges in the country today. As you all are aware about the National Dangerous Drug Control Board, it is usually work on the demand reduction of the drug control. And we have several sections and we have several services conducted throughout the country, including the prevention, education, and training. And we also have the treatment and rehabilitation centers. There are 4 centers in all over the country, that Kandy, Tambua, Gol, and the Talangama. And we have community outreach services with the 20 outreach officers in all over the country and 300 officers in the all ages divisions. And we also have a research and laboratory service. And we have narcotic laboratory. This is one of the main narcotic laboratory in the country. And we also have the precursor control, we are controlling the precursor substance which used for the synthetic drug manufacturing. So, and we also have a international commitment, and we are signatory for the 3 conventions, and we work all 3 conventions together. So today's topic is from data to action, the National Insight into Substance Use Trend and Public Health Response in Sri Lanka. The presentation outline also the framing SUD in public health context is the main theme of this public health forum, and the national policy direction and the commitment, and the drug use trend, and in the today what are the global and local trends, and what are the from data to action what the NDCC done and NDCC are doing, and the community and system level innovations, strategic priorities which moving forward, and what conclusion and call to all action. SUD, it's a public health issue or the issue of the criminal justice. It's a debate in Sri Lanka that, but in the global trend, it's considered as a public health crisis. Why I say it is public health crisis? Uh, we can see the increase in health burden due to the substance use disorders, rise in the prevalence of substance use disorder globally and nationally, contribute significantly to mental health disorders, chronic diseases, premature death. It linked with the non-communicable disease also, the liver diseases, cardiovascular diseases, and further it's also linked with the infectious disease like HIV and hepatitis C. There are social and economic costs due to substance use disorders. They reduce the workforce productivity and increase unemployment and the absenteeism in the work, and that lead to the family breakdown, domestic violence, and child neglect. And it was the heavy economic burden to the healthcare, criminal justice, and the social welfare system. And there is a vulnerability to the youth and the marginal groups. The adolescents, young adults, and are increasingly exposed to drug due to the peer pressure, media influence, and the lack of awareness. The marginalized communities face limited access to prevention and treatment service also. That also the issue in the Sri Lanka too. The burden on the health system. There are overcrowding in our treatment centers and the rehabilitation services. Lack of trained health professionals to manage the substance use disorder, the people with the substance use disorders. At the emergency and psychiatric services also, they also have a burden due to this SUD. And the public safety and community harm, that also issue with the SUD. Substance use is associated with the crime, violence, road traffic accidents, treatment, community safety, and increased pressure on law enforcement and public institutions. And what type of this is categorized for the SUD in ICD-10 classification? Still we are using ICD-10, and in F10 to F19 is categorized the substance use disorders, which are mental and behavioral disorder due to psychoactive substance use. F10, just remind that F10 is alcohol, F11 is opioid, the mental and behavioral disorder due to cannabinoid. That's a 12. There are up to 19. There is categorization also. So we can think this is kind of public health issue than the criminal justice. What are the policy directions we can see? We have policy. Now we are also amending the policy. There are few pillars based on the policy: the prevention and education, treatment and rehabilitation, supply reduction, and effective enforcement of law and the international cooperation. We can see the police arrest due to substance use. It is increasing. There is increasing trend, 2020 to 2024. And the special thing is the synthetic one, that methamphetamine arrest also becoming rising now. It's a rising trend. What's the global situation? Affects the estimated 64 billion people, according to the World Drug Report 2025. The new challenge we have the abuse of control of pharmaceutical drugs. Mostly, you know, the tramadol, diazepam, pregabalin. This also controlled by the Act number 41, 2022, the Poison, Opium and Dangerous Drug Amendment Act. We can see the diversification of the drug market, emerging synthetic drugs, and a new psychoactive substance, NPS, the we call NPS, and polydrug use among youth. Mostly the cannabinoid, the kush, hashish, that are also listed here. We can see the new trends. we also have a precursor chemical control authority. So we found last year there are canals in laboratories, and there are two we were detected. Now the drug market is more sophisticated and more technological driven. They use the darknet site, which is not usual browsers. There are Tor browsers, and they use virtual currencies, and use the transport mechanism to the postal transportation they use. There are so many techniques they use with the bound with the technology. What are the NDCB response for that? In recent past, we are more emphasize on the expansion of the residential treatment capacity and the government fund that we are planning to expand the services and strengthen the existing rehabilitation services. And also we strengthen the community-based treatment and prevention intervention, that also through our community-based services as well as with the collaboration with the primary health care system in Ministry of Health. We are planning work with the primary health care new project. And the expansion of the community outreach cover up at the divisional secretary level, which also now we are doing with the 300 our officers. And we are on the way to the national revision of national policy that was more strengthened with the new challenges and especially with the technological challenges. Laboratory and the scientific service also we plan to improve, and we are on the way to improve. And monitor, and we also more emphasize on the monitoring of precursor chemicals. Nowadays we are launching national-wide outreach program with the trained officers, with the new funds, with the government funds, and we also tested the community-based treatment models, and we are treatment manuals also now we are revising with the support of the Ministry of Health NCD unit. And we strengthen the divisional and district provincial drug prevention committees will be conducted in the district secretary level and the divisional secretaries level. And the development of, as I told earlier, the development of manual for community outreach intervention also, and continuous capacity building for field level officials, and we strengthen our call number 1927 telephone line. And we also encourage intersectoral collaboration. Now we are that this is also evidence of that. And we expand access to evidence-based treatment service at the community level in collaboration with the primary healthcare service, which are also I told earlier, with the help of the Ministry of Health in their primary health strengthening project. And address the social determinants and public health consequences of drug use under the demand reduction approach through the cross-sectional collaboration, and building national capacity through the research and innovation. Before I wind up that, what are the call to actions? Turning data into action is not a just process. It is a commitment to save life and building healthier communities. SUD must remain the national and global public health priority. NDCB invite all partners, stakeholders to collaborate with, because one can't work with this. We need all support from all partners, all stakeholders. So together we can transport evidence into lasting impact. Thank you very much.
Thank you, Dr.